Thank you very much for your nice presentation. Actually, this time we will start at 9, so maybe I have 20 more minutes to spend. Anyway, the topic was given to me is more than 30 years journey as a pediatric cardiologist. It's very broad and a big burden to me, so to speak in 20 minutes. So I narrowed down my topic to target shift. The issue I selected is based on personal experiences, so maybe biased, and then maybe specific to Korean society because I have no much experience about the outside of the Korean cardiology society. So the issue I selectively selected to emphasize beyond the heart. Actually, we all cardiologists and cardiac surgeons and spend much time to correct the anatomic defect or correct the blood flow in the heart. But there's something more, I think. So I selected the issues beyond the heart. This is the contents of my talk. Achievement in congenital cardiology during the past several decades, and the outcome of these achievements, and the current situation of the adult congenital people. And we will spend our time in the clinic and examine the heart and echo intervention and so on. But beyond the heart, there is much more morbidity, chronic kidney disease, chronic liver disease, and so on. And then, beyond our clinic, in the society, in the home situation, there is a much more thing for us to think. So the next target in closing. So we have achieved a great achievement during the several decades, as you know, nobody argued. This is the title of this article, the remarkable journey from the past, from the post-mortem room to adult clinics. I think this is the most concise sentence, and the implication is very clear. The big achievement. Actually, the 1940, there's some of the pioneers in congenital cardiology or surgery. They make epoch-making progress. Actually, in at least several decades, there's a very big progress. And then my question is, why do we care the congenital patients? Nobody argues of the primary goal, life-saving. And then life-saving without significant residual and sequelae. And nobody argues about it. Actually, we may think perform the first survival. We saved many babies with congenital disease to adult, but without significant residual sequelae. I don't know. I'm not sure about it. And then I don't know exactly what's the next. Why do we care? Take care of the patients. So that before I conclude, I think it is necessary to check the contemporary situation of the survived patients. This is the Canadian data. There's a steady decrease in age of death and increasing number of the severe congenital disease. And decreased mortality is definitely true. This is the Canadian data. Both of the Canadian data is the infant mortality decreased very much, and the proportion of the mortality moved to the adult age. So they're quite similar to general population, but there's still increased mortality in infant, but compared to the 1987, is very much decreased. But the other thing is that there is increase in severe congenital disease among adult patients. The current situation of the adult congenital disease is the summaries like this. They have multiple morbidities, and cardiovascular system is prematurely aging and face the early death. This is the table, the article from the table from Gatzolis group in UK, and they made this table. Let's examine Fontan situation, 40-year Fontan patients. Their 5-year mortality is when you compare the general population is 75. So that means it's a simple comparison, but this indicates that 40-year Fontan without complication, their cardiovascular age is in general population 75. So this is another study. The median mortality of severe disease is 53, and moderate 75, and simple cases 84. So in simple cases or in moderate cases, we can achieve a big progress, but in severe disease, still there's much thing to do. The cause of mortality is shifted very much to cardiac to non-cardiac. This is the Gatzolis group of UK, and heart failure and sudden death, but the other thing is non-cardiac cause. And also in simple disease, it's very similar to cardiac and non-cardiac cause, but in severe disease, still cardiac disease has a big proportion as the patient ages. In cardiac cause, heart failure become more and more, they suffer from heart failure, but in sudden cardiac death, there's a not increase the instance as the patients become aged. The other thing is beyond the heart, they suffer from many social challenges, employee insurance and so forth. So all these things are very big problem to the individual patients. So the outcome of the great achievement is just to shift the congenital population from infant to the adult ages. The adult age has a multiple morbidity and mortality and early death. My think is congenital is not a heart disease. I think congenital is a systemic disease. Systemic disease, we don't know the clear feature of it. Our primary focus is the heart disease, heart defect effect. But even though we can correct the blood flow in the heart, close the ventroseptal defect, and rerouting the flow from the RV to pulmonary, LV to aorta, there's an intrinsic defect here. So the myocardial dysfunction or myocardial failure is inevitable. The other aspects of congenital heart disease is the sudden death, arrhythmia, and heart failure, but these are common disease. In some cases, with the ion channel disease like Long-QT syndrome or Brugada syndrome, if it is associated with the congenital disease, they may be, we can think separately, but in the other case, this is the common disease. We often neglected the extracardiac complications, but all of these are very important factor to morbidity and mortality, and they cause vicious cycle, extracardiac organ and heart, vicious cycle. And they usually start early, but in covert stage and become overt very late in the lifetime. There is emphasis in AHA statement circulated 2017 of various extracardiac complications of the adult congenital heart disease. As the patients become older, as aging, the cardiovascular disease and cardiovascular risk factors become prominent and become main factor to the morbidity and mortality. In congenital disease, the traditional morbidity, in addition to traditional morbidity cardiovascular risk factor, there's additional factor related to heart disease per se. So there's the cardiovascular disease and cardiovascular risk factor is increasing and very big burden to the adult patients. The other study shows that the cardiovascular risk factor like hypertension, diabetes, or obesity become more evident in the earlier age than general population. So I especially selected the slide because the liver is maybe become an epidemic in the later period. As you know, the Fontan is a very Fontan complication, and liver disease is a Fontan complication, and you know very well, the so-called Fontanosis liver disease. As we know but we know the solution, but we know this the very huge complication. But besides Fontan states, there may be a big epidemic. I don't know exactly the number, but as the patients become ages and the right heart failure become evident, liver disease become more prominent. So the adult congenital, the systemic disease with unprecedented features. I selected this term because the congenital is there is a whole life burden of the cardiovascular system from the fetal state to infant states and to older states, and then as a result, this as a combination of this, the heart failure manifestations in congenital heart disease. So that we don't know the exact feature of this. We have idea from the adult cardiology in general populations. Normal heart developed ischemic cardiac disease, hypertensive cardiac disease. So we can borrow the information, or also we can adapt the information from infant cardiology, the congenital defect, hemodynamics. But in these patients has a different feature. We don't know exactly how to manage them. And what happened beyond our clinics? This is the lifespan of the congenital heart disease patients. They have from the fetal stage, they have suffered from stressful organ formation, or brain formation is malformed, and they many operations, stress frustration, and they persist. They become in the school ages, adolescent, they become to competition with the peers, and they become independent person. And if the situation is well, they have their own dream and hope during the service, or if they are not in good stage, they become depressed and withdrawn from the society. Also, in family, and there's a big burden to the family members, especially to the mothers. I emphasize the adolescent age because I think this is maybe the last or only chance of the adaptation to the society. We can correct the person when they are young, but I don't think we can correct the person when they become adult. So the adolescent age, maybe we can control the personality or social adaptation and neurodevelopment at first, the only state. But there's a big care gap. Every parents or the patient individual think I'm cured, I'm well, I can live as a normal person. And the other thing is that as we save the patients, there is an emphasis on quality of life. So the brain function is very important in maintaining the quality of life. So the psychologists just, in chronic disease, everybody has, every family member has psychological stress. So we can imagine. But at the pediatric cardiologist, we have very much time to support the cardiology problems, just to show this sympathy on the patients or the discussion with the patients when they visit the clinic. But we usually, I don't know, I usually neglected it, but you may not, because the warm discussion, warm talk to the patients may save the children from the psychological stress. The other thing is that this congenital brain is not normal. This maturation, destruction of during the fetal stage or the perinatal stage, around the operative stage, there is encephalopathy of the congenital. Initially, perioperative state or the perioperative state, pre and postoperative stage become a dominant factor to the neurodevelopmental delay, but the study shows that it's only a minor portion of the factors. The innate factor is, we cannot modify the innate factor very much. We can modify this part, but we cannot modify this part. This is a very big portion of this. So it's very important to understand the brain in congenital disease. The initial started as a focal lesion, is the arrest of the progression of the late oligodendrocyte progenitor cell, and the white matter disease or subcortical neurons, and then they become a larger portion and affect the mental or psychological or neurologic disease later. So it is clearly shown that the defect in the perinatal state or the infant stage become manifest as the child enter the school, and there's a new motor delay, learning behavior, and the school performance delayed. What the recent study shows that this defect influence the adult ages. This is the recent publication, maybe I think it's from Denmark National Study. The 2018 in circulation, there's increased risk of dementia, even in young adults. Even in young adults, there is increased risk of dementia. In summary, the brain dysfunction can cause lifelong injury. There's a different feature of the brain or mental dysfunction, but it can influence the permanently. So they begin as a neurodevelopmental burden, and they become a cardiovascular lesion in adults, even in young adults, and dementia. So we have a big progress for the several decades, saved 1,000 people's baby born with congenital disease. Currently, the epidemiological studies, or maybe 90% of the baby can survive to the adult age. It's a very big burden. We have a very good job to do. But the basic question is, why we treat the patients? I think the target must be shifted from life-saving to healthy, independent adults. This is WHO criteria of the healthy. I don't know how to do this, to perform this one, but I think some of this can improve the survival of life and quality of life. The integrate not heart only, beyond the heart and beyond the clinic. Surely we need to advance the science, and actually as a pediatric cardiologist, we must broaden the scope, not only inside the heart and outside of heart and outside of the clinic. And if we cannot correct it completely, we cannot change the nature. If we cannot change the nature, then we must rehabilitation systems support, then try to remodel to the normal part. Actually, cardiac rehabilitation become much more emphasized recently, and neurological rehabilitation is very important and need to start as soon as possible, and pulmonary and other rehabilitations. And probably to do this, good organized system is absolutely necessary. I think the transitional system, adult congenital heart special care clinic, and scientists, and so on. I only present two cases. This case is the 13-year-old male, post-TOF. Actually, his mother found that he had something in his eye, some foreign body in his eye, but he cannot notice. So he take the ophthalmologist, and there is he cannot feel this foreign body in his eye. The other patient, a 33-year-old male, very active and very good-natured personality, but he self-discontinued his job because he complained that he cannot memorize recent things. So he stopped his job by himself. So it depends on whether we have a success or whether we do failure. I don't know exactly. It depends on your decision. So then my final slide is that I adapted things from the article. Intervention trigger change in totally unrelated fields for which the only remedy is continued intervention. For that reason, we may never reach the finish line. I think despite our big progress for the several decades, or due to the pioneers in congenital cardiology, and we are still doing very much to do something, but we are just opening the window of the congenital. We have a lot of things to do in the future. Thank you very much.